Greetings, speechtherapypd.com community. Welcome back to another enlightening episode where we're going to explore the intersection of healthcare, compassion, and knowledge. Today, we have a distinguished guest with us who's really ready to unpack the complexities of speech, cognition, and swallowing assessment for individuals navigating the challenges of Parkinson's disease. I'm your host today, Stephanie Michele Sweigart. I am a licensed and practicing school-based SLP out in Los Angeles, California, and my pronouns are she, her. And joining us today is SLP Amy Larocca, an expert in the field who has dedicated her career to really understanding and addressing the unique needs of those with Parkinson's disease. She's also the owner and the lead speech language pathologist at Polaris Speech and Neurological Rehabilitation, which is a hybrid private practice in Northeast Ohio. And she's bringing with her 17 years of clinical and teaching experience where she's working with patients and specializing in evaluating and treating patients with Parkinson's and other neurological diseases. So hello, Amy. Thank you so much for being here with us today.
Yes, thank you so much for having me.
Absolutely. Okay, so we know you're in Ohio. What are you involved in right now? What are some of the projects that you might be working on currently?
Oh, all the things, but it's all fun. So I have my private practice. I see people in their homes, online, or in my office, primarily people with Parkinson's. I also work with myofunctional disorders as well, which is actually a really interesting intersection, working with airway health. And so I really focus on looking at the whole person in general. So I have my practice. We also contract with a really neat program in our area called In Motion. It's a completely free to the participants. It's a nonprofit organization that provides free exercise, yoga, art, music classes for people with Parkinson's. And
No,
so
wow.
so we contract with them to provide, I have a speech class, a cognition class, um, one that's kind of a mix of the two of those, and then I have a speak out loud crowd class there as well. So it's really
Oh my
working
gosh,
on
so neat.
helping those individuals with Parkinson's to be able to maintain all the skills that they have, that prehab. You know, we talk about if patients go and have knee replacements or things, they go for prehab sometimes. This organization is all about helping them where they are right now and slowing, getting better every day is their slogan. So,
Wow, I can honestly say this is the first time I think I've heard the word prehab instead of
oh,
rehab.
really?
Yeah, I've heard
Oh,
of
yeah.
being like proactive, and I'm thinking prehab, is that like being like reactive, or I mean proactive before rehabilitation?
Yes, yes, yes. And
Oh,
so that's a big part. Think about people with Parkinson's, and it's a degenerative disease, right? So if we can help to take their strengths, take what they have now, and prepare them, give them the knowledge of what may happen, as everybody with Parkinson's is so individualized and so very different in their journey. But if we kind of arm them with the knowledge of here's some, areas of cognition that may give you trouble along the way. Here are some strategies that can help to make it easier for you. And here's why it's really important to stay in all of your everyday activities that you love to do that are really good for stimulating your brain. This is the importance of that. So I
love
really, with this population, it's important in this course we're talking about assessment and identifying. The most important thing is identifying their strengths. And so what are their strengths right now and how can we help them to maintain all of those strengths, use their strengths to boost the areas of challenge that they have, um, along the whole continuum of their journey with Parkinson's.
Wow. Oh my gosh. Okay, this is inspiring. This is exciting. So I'm hearing a play on the strengths to support, because we know that Parkinson's disease presents this spectrum of challenges, right? And that's
Yes.
kind of your course. I'm super excited about your course that's coming up on speechtherapypd.com, because I think the goal, right, is to really provide these insights that can make meaningful impact into the lives of those that are affected. And not only just for those affected with Parkinson's disease, but maybe also for the professionals who are caring for them. I think so. The golden question I think we have for you today, I'm an SLP myself. We have a lot of SLP and SLPA listeners for this YouTube channel. The golden question we have for you is, what would be 3 takeaways that speech clinicians must know when it comes to maybe the evaluation process, for example, for patients with Parkinson's disease?
Yeah. So that's a really good question, because I feel like there's a couple of different aspects when we're talking about assessment. There's the nitty-gritties of what screenings and what tests are validated for people with Parkinson's, what's reliable, and I cover that in the course. But I think in general, as you already alluded to, is that people with Parkinson's are so individualized. You're never going to meet 2 people that have the exact same symptoms, have the same course. And so I think the first thing to really think about when we're talking about assessment is to appreciate that uniqueness, that each person with Parkinson's symptom presentation is unique. And so you're not going to have the same presentation in 2 different people. So from the get-go, you can't assume anything. There's 4 different hallmark symptoms of Parkinson's, but there's 40 different possible symptoms of Parkinson's in any combination. So you can't assume that somebody's going to present in a certain way. So that communication has to be so open with the person that you're assessing from the very beginning, asking them a ton of questions and not just assuming that they have certain symptoms. So I think that open communication just helps you to be able to understand that individual person's experience with Parkinson's.
I love that takeaway. Open communication.
Yes. So very, very important.
Bring the curiosity, ask the questions.
Exactly. And that's why I love this course, because I actually just got off of recording a portion of it with 2 individuals with Parkinson's and Parkinsonism, and they shared their perspective on interacting with people, with providers, and kind of their experiences and their recommendations. So it's not just talking about, from my perspective or research and what we know, but we're hearing from people with Parkinson's and their perspective of being a unique individual.
Yes.
Yeah. And so that's really, I think, a really important aspect of this course. So the second aspect of assessment with people with Parkinson's is to really consider the why behind each symptom. So understanding the neurophysiology behind Parkinson's is so very important to understand why you might be seeing or why that person might be reporting the challenges that they're having. And so, in understanding that there's non-motor, cognitive, motor functions, all involved in interacting. So if a patient's reporting that they're falling, we might think, oh, okay, that's a physical therapy thing. We'll make sure that we tell physical therapy about that. Or if they're having freezing episodes, or if their patient you're saying that they're having difficulty jumping into conversation, but then we assess them and their expressive and receptive skills are within normal limits. It's because cognition has so much impact on fall safety and balance and freezing of gait. Inhibition has a big impact on freezing of gait. The quickness, the speed of processing has a big impact on being able to jump into a conversation. So if you are hearing these challenges, it's really important to understand how the uniqueness of Parkinson's can impact their communication or their physical abilities.
And that's the
why. That's the why, yeah. And it's going to then drive your treatment, which is going to be part 2 of the series that we're doing later.
Awesome.
So, yeah. And the third takeaway is really that the ultimate goal of your assessment and interaction with your patients is always quality of life. Every question that you ask them should be centered around what are their experiences? What is their quality of life like? What do they value in anything from the provider, patient relationship to their everyday experience? What are those what are those interactions that just give them joy throughout the day? And are they still able to do that? Are there any challenges in that ability to fully participate in their everyday life like they would like to? Not like you think they should. And that's that going back to the communication, but really understanding their perception of what quality of life is, what how they perceive it, what's important to them, and make sure that we're addressing that in our assessment so that then we are addressing that down the road in our therapy.
Makes
So I
total
think
sense.
those are the three big things is making sure that you understand the uniqueness of Parkinson's, that you're considering the why behind each of the symptoms, and that the ultimate goal is their quality of life.
And I love how you just wrap those up, summarize those, and we have those listed here below for everybody who's taking feverish notes right now with all of your good information that you're sharing. Wow, well, this is really wonderful. And I know this is just sort of touching on all that's to come with your course, which sounds like there's a part 1 and part 2. I didn't know there was a part 2. That's wonderful, which will be coming up this month. Now, tell me, you're a wealth of information. You've got your hands in a lot of different projects, wearing a lot of different hats. And I love meeting SLPs who are doing that. It always amazes me and inspires me. If people wanted to reach out to you specifically or learn more about you or have a question or want to find resources, where would they be able to do that?
Yeah. So my website, I think, has the majority of my information on it. So if you go to polarisspeech.com, so POLARIS speech.com, it has all the information of programs that I have for patients. I have some online wellness classes that people with Parkinson's can take to learn more about cognition and speech and swallow. I also offer clinician mentorship. So I have some mentorship opportunities or even just consultations if they have a difficult case. Or if you're looking to get into working with people with Parkinson's and want an ongoing mentorship relationship, I have those opportunities
That's
too.
amazing.
So yeah, I love the teaching aspect of what I do. I taught for a while, but then I missed the patient aspect. So now I get a little bit of both
Yeah,
and
well,
really, yeah, I really just love this population and being able to support them along this journey that can be hard, but that you can really help to support their joys along the journey too.
yes, it can be really hard, but I really hear your passion and your enthusiasm around this topic, and we so appreciate you and all of your wisdom and just all the things that you're doing to support this community. So thank you so much.
Yeah, not a problem at all. I love it.
For anybody listening, we'll put in the show notes below a link to the website where you can literally just tap on that link below right now and head right on over and be able to connect with Amy. As we wrap up today's insightful conversation regarding the world of Parkinson's disease, let's carry the spirit of maybe present moment awareness and compassion forward, remembering, as we've talked about today, that each person battling Parkinson's disease has their own unique story, and every step that we take to really understand them and support them and uplift them can just really make such a world of difference. So in the comment section below, if you feel inspired, I really invite you to share your thoughts or experiences or maybe any strategies that you've tried that you've found effective in fostering this compassion and awareness in your own interactions or at your job sites, because together we can really create this community that not only seeks the knowledge to teach us, right, but it also embraces empathy. It's so very important. So a heartfelt thank you to you, Amy, for sharing your expertise and your obvious passion with us today. Thank you so
Well,
much.
thank you, Stephanie. Yeah, I appreciate it.
Yes, it's been lovely talking with you and hearing all that you're involved in. Thank you to everybody else who is listening, our community out there at speechtherapypd.com YouTube channel. Thanks for joining us on this really meaningful exploration. We're very excited about this course that is coming out. So let's remember, everybody, let's continue this journey really with open hearts and mindful minds and a commitment to really making a positive impact in the lives of others. And remember that even the smallest of acts of kindness can really create this ripple effect of healing in our journey. So to To take a deeper dive into this topic and further your education, please check out the course Speech, Cognition, and Swallowing Assessment for people with Parkinson's disease. And this is with our presenter today, SLP, Amy Larocca. For other topics, when you subscribe to speechtherapypd.com, you're going to get 1 year access. And this is to over, I think it's 1,000 and counting live and on-demand courses. And you're going to earn those ASHA CEUs. So you're going to get CEUs for taking Amy's part 1 and part 2 when you complete those. If you're new to speechtherapypd.com, you can access a free course. So please see below for details on that. Don't forget to hit that subscribe button, give us a thumbs up, and join the conversation in the comments below. We will see you back here soon as we are answering more of those golden questions.